Today's episode is for anyone living with diabetes or caring for someone who is. Whether you're newly diagnosed, confused about what to eat, or just trying to stay on top of your health, this episode is for you. Welcome to another episode of Thrive in Canada, the show that connects newcomers, immigrants, and longtime residents to services that can help them live fuller, healthier lives here in Canada. We're joined today by a certified expert who's on the front lines of diabetes education, working directly with people in Scarborough and beyond. Please welcome Janny Wan. She is a registered dietitian and certified diabetes educator from the Scarborough Center for Healthy Communities. Hi, Janny. Thank you for joining us today.
Hello. Thank you for having me.
So let's start with the basics first, because a lot of people hear the word diabetes, but they don't really understand what it means or the extent of what it means.
Diabetes is a chronic condition when the body is not able to produce enough insulin and or not being able to use insulin effectively. That results in a higher blood sugar level. And the reason why diabetes is called a silent disease is not because it doesn't do any harm, but it actually, which only show itself after it might have done some harm already. A lot of people live with diabetes for many years without knowing that they have diabetes. So it's estimated that 5% of people in Canada, they live with type 2 diabetes and they don't know it's undiagnosed. That goes to show it's very important to do the screening and not just based on how you feel, because when your blood sugar gets a little bit high, your body might try to adjust. So the symptoms might not show immediately.
Right.
So when your blood sugar is slightly high, it doesn't really cause any acute pain. So people might not be alarmed. So that's why it's a silent disease.
Oh, okay. And what are the consequences? Like, how dangerous is it to live with diabetes and not know about it?
Yes. So the complications of diabetes includes chronic kidney disease, retinopathy, like bleeding in the retina, nerve damage. So people might start feeling tingling, numbness, burning sensation under their feet, stroke, heart attack, and peripheral vascular disease. So all of these are common complications of diabetes. If you don't know you have diabetes, then you wouldn't be aware to change your lifestyle or to manage your blood sugar, and your risk of these complications might increase.
Before we dig deeper into the type 1, type 2 diabetes or pre-diabetes stage, can you tell us a normal healthy body, how does it process insulin? That will help us understand when it's not processing it properly.
When we eat food with carbohydrate, so it turns into sugar after we digest. So when our blood sugar level increases, our pancreas will produce insulin. It's a hormone, so it goes into the blood. And I like to use the analogy of key and a lock. So insulin is like the key. It takes the sugar in your blood and it unlocks the doors on the cells that make up your entire body, so that the sugar can go from the bloodstream into your cells to be used as energy. Without insulin, the sugar stays in your blood and it cannot be used.
The abnormality happens when there's too much sugar, you mean?
It happens when the pancreas, you can say it gets tired, and the cells that produces insulin called beta cells, as we get older, it's a part of aging, so we only lose slowly the amount of beta cells that we have in the pancreas.
The ones
we
that
don't
produce the
generate
insulin.
new ones. We don't make new beta cells. We only have less and less. So as we get older, we produce less and less insulin. So diabetes is when our pancreas doesn't produce enough insulin to process the sugar, to bring the sugar down. Or there can also be insulin resistant, where the cells in the body, it doesn't recognize or respond to the insulin properly. When the insulin gets to the cell, it can't unlock the door. It's called insulin resistant. So there can be a lot of genetic reason, but we know that being overweight or obese, so carrying excess fat in the body can cause someone to have insulin resistance. So the insulin, your pancreas try really hard to make extra amount of insulin because it can sense that your blood sugar level is already higher than normal, but the body is not able to use the insulin properly because of the insulin resistance. So if we use the key and lock analogy, even if you produce a lot of keys, but if someone build a wall in front of the cells because of that excess weight that we carry, the key cannot get to the door in the first place, so causing the insulin resistance.
Yeah, so it's not making the key effective. Even if it's there,
Yes.
it can't get through. So let's talk about the differences between type 1 diabetes, type 2, and when you're in the pre-diabetes stage.
There's different types of diabetes. Type 1 diabetes, it's a non-preventable autoimmune disease where most people get diagnosed when there's no really known cause to why someone will develop type 1. Out of all the cases of diabetes, type 1 diabetes take 5 to 10% of all the cases of diabetes. Majority of the cases is type 2 diabetes, which takes up 90 to 95% of all diabetes cases. When the body produces not enough insulin and insulin resistance, we know there are risk factors to develop type 2 diabetes. So for example, if you have family history, if you have history of pre-diabetes or gestational diabetes or a history of high blood pressure, high cholesterol, age of 40, and the older you get, the higher the chance of getting type 2 diabetes, ethnic background. So there's different risk factor that is known for someone to develop type 2 diabetes. But a lot of people say that type 2 diabetes is a preventable disease. If not, you can delay type 2 diabetes with healthy lifestyle modifications.
So you mentioned about ethnicities. I wanted to ask you that, if it's true that diabetes is common among certain ethnicities. So here's what I researched, and let me know if these matches with what you have observed on the ground. Certain ethnic groups have higher genetic and lifestyle-related risk of developing type 2 diabetes, and to a lesser extent, type 1 diabetes. And here's an overview of the ethnicities most prone to diabetes, particularly type 2. Versus South Asians, includes people from India, Pakistan, Bangladesh, Sri Lanka, Nepal. Higher risks at lower body mass index than other groups, and they often develop diabetes at a younger age and at lower weights. So the second group is indigenous peoples, including the First Nations, Inuit and Métis in Canada, Native Americans in the US, Aboriginal Australians, and Maori in New Zealand. Rates can be 3 to 5 times higher than in the general population. And according to at least my research, this is linked to historical trauma, poverty, limited access to healthy food and care. The third group is Hispanics and Latinos, includes Mexicans, Puerto Rican, Central and South American descent. They're said to have higher prevalence of insulin resistance and gestational diabetes. There's an increased risk of complications like what Janny mentioned earlier, kidney failure. Also, African and Caribbean descent, African Americans and Black populations in the Caribbean and elsewhere have increased insulin resistance and often poorer outcomes due to systemic barriers to health care. They're said to also be more prone to hypertension, which compounds the diabetes risk. East and Southeast Asians, and this includes the Filipinos, Chinese, Japanese, Koreans, Vietnamese, and just like South Asians, they may develop diabetes at lower BMI. Strong familial and genetic components are at play here. Diet and physical inactivity also contribute, also with Middle Eastern and North African. So that's kind of what I gathered.
People from certain high-risk ethnic background, which you listed out, don't have a higher risk of developing type 2 diabetes. That means they get higher chance of developing type 2 diabetes even when they have no family history or their weight is, they're not overweight or obese, simply because of the ethnic background. They get higher risk.
Okay, that kind of includes a lot of ethnicities, and especially here in Canada where it's so diverse, right? We have all of these races here, and I'm sure in Scarborough you get to encounter a lot of them. So why do you think there's an increased risk for these groups?
The reason might be multifactorial. You have touched upon some other than maybe they are genetically predisposed to having type 2 diabetes. Other factors can include social, economical, and stress. So especially immigrants in Canada, when they're the stress that comes with adapting to a new culture and they're not familiar with where to get their cultural food, where to buy, how to engage in physical activity, where they can go to do exercise, and how to access health care in a timely manner. They might be, there's a language barrier, so some of them might not know how to speak English, and they don't feel comfortable seeing a provider that doesn't speak their own language, which delays the time that they should seek. So do the screening for diabetes or seek care. So all these factors.
Wow. Yeah, that's true. I never thought of it that way. That these, when you're a newcomer, and you have all these barriers, just being in a new country and trying to adapt might be increasing your risk.
When they move to Canada, they are not able or they're struggling to get occupation that they originally have back home. So they might experience poverty or food insecurity because of not being able to find a job. The income, as well as like adapting to a new environment and all those factors.
No, that's true. And we're going to get into food a little later on, which I'm sure everyone can relate to, whether it's diabetes related or just actually being healthy. So do stay tuned for that part just a little later on when we talk about food. But let's first talk about the early signs that people tend to ignore. What are these symptoms that you might be in the pre-diabetic or even a full-blown diabetic case?
So some symptoms of high blood sugar includes extreme thirst or frequent urination. Some people might experience having infection, easier to get infection, or their wound, if they get a cut, it heals slower, and they might feel tired, fatigue. You can imagine when you have these symptoms, you might not automatically think, oh, diabetes.
I'm already doing the checklist in my head. I think I'm feeling a few of those.
Some people, when they experience these, it's easy to blame it on stress or aging. So they might not think that, okay, I should get it checked out for diabetes.
So they should. At least, what kind of tests would be done?
So,
or should they go for?
Anyone above the age of 40, at least once every 3 years, should screen for diabetes. If you have risk factor that I just mentioned, you have family history, you're from a high-risk ethnic background, history of pre-diabetes or gestational diabetes, high blood pressure, high cholesterol, overweight. If you have risk factors for type 2 diabetes, you should start screening even before the age of 40 and screen more frequently. Like if you go to do your annual body check with your family doctor, primary care provider, once a year, if they do take your blood, they can check something called A1C. That reflects your blood sugar, 3-month average blood sugar. So it's not just what you ate the night before, because sometimes when they see A1C is high, they might say, oh, because I ate something sweet the night before. But that A1C doesn't affect by what you ate the day before, the night before.
It's a 3-month.
Past 3 months average.
Is this the one that requires the fasting? No,
You don't
it doesn't
need to
require
fast
the
for that
fasting.
one.
Okay, so for newcomers accessing healthcare in Canada, and it can feel overwhelming, like what we talked about earlier, how do you help clients take the first step?
Yes, it would be challenging, but I would encourage just take small, realistic steps. So I would encourage everyone, newcomers, try to seek primary care, to go see their primary care provider at least once a year to do the blood work, body check. That's usually the first sign that your blood sugar have increased. That's one thing, and knowing that there are a lot of resources in the community, free resources in the community, including from our center. You just need to look. So in terms of improving your blood sugar level and well-being, overall well-being, try not to be overwhelmed and try to take realistic steps, like by making small goals. So it can be small things like instead of white rice, try to have brown rice a few times a week, or instead of having a sugary drink, try to have water with lemon or lime. Small things like that, taking small steps, which can have big effect.
Right. You mentioned about your particular program. Can we talk about that? Like, can you give us an overview of the SCHC diabetes program? How is it different, or how does it really get to help the patients?
The diabetes education program at SCHC, it's a big team. So we have 5 registered nurse, 5 registered dietitians, and 1 social worker. We have 2.5 administrative assistants and 1 endocrinologist. So and we have 4 locations across Scarborough. So we're relatively big team, and among all of the provider in the diabetes team, we speak 9 different languages. But if a person come to our program and they don't speak any of the language we speak, we do have access to an interpretation service. So all the services at the diabetes program is free of charge, and we do see, other than people that have OHIP, we do see people that don't have OHIP, uninsured. People with no status.
And they have to live in Scarborough.
And they do not need to live in Scarborough. So we don't really have a catchment area. We do encourage, if someone live in an area where they have a close by, they have a diabetes education program or a community center close by to where they live, it's better to go there.
Yes,
but
of course.
There are people who live in area where there is no community health center or diabetes program. So we do see people from outside of Scarborough, and they don't have to have a referral from their doctor. They can just call and then self-refer. So if they have pre-diabetes or type 2 diabetes, they can self-refer.
What do the services include? Like from the start, like if they're just maybe thinking I might have diabetes, do you do the testing? Do you do, or that's...
Yes. So we do see people living with pre-diabetes or type 2 diabetes, or we see people with gestational diabetes, but only if they are uninsured. People with gestational diabetes that have OHIP, that are insured, they would see the hospital diabetes center. Otherwise, we see people one-on-one. So we help them with, like, if they don't know how to check their blood sugar or use the machine or put the sensor, and how to inject insulin, when to take their medication. The timing is very important if they're taking their medication at the right time. So we do group sessions as well. So the group session is, we just give an overview of everything, like what, understanding diabetes, what is diabetes, complication, risk factors, how, what to eat, exercise, the general overview how to manage diabetes, and that's usually for people that are newly diagnosed with pre-diabetes or type 2 diabetes. We also have diabetes support group that's run by the social worker in our program. So every few months, the support group can be any topic. So the coming one is Zumba. They're doing Zumba. So it can be they can invite guest speaker to talk about kidney disease, something that is relevant for people living with diabetes and try to manage their control their blood sugar. And occasionally we do have exercise programs. So and we do a lot of outreach. So we do community workshop, like healthy eating workshop with in the community, partnering with different community agencies.
Is consultation a part of that, or
Yes.
should it be clear that that's for the doctor to do? But then you have nurses also, right?
Yes, we do consultation. Yeah, one-on-one. And sometimes we can try to communicate with the doctor if we feel that maybe this medication is useful or this medication might not be beneficial. So we can try to advocate on behalf of the
patient.
client. Yes.
That is that's a big help. Now let's talk about food, because one of the toughest parts of managing diabetes is food. And when we talk about Filipinos or South Asians or Caribbean cuisine, it's personal and it's cultural. So how do you even begin to help people change their habits?